Outbreaks of a virus known by the unfortunate nickname, it's not a laughing matter. We're going to tell you why in a second, but it's called the winter vomiting disease, and the cases are rising across the U.S. According to the CDC, state health departments reported 91 norovirus cases during the week of December 5th. That's the latest data that's been made available, and it's almost 3 times greater than the average weekly high of cases reported between 2021 and 2024. Dr. Celine Gounder is here with me in Studio 57. She's a CBS News medical contributor and editor-at-large for public health at KFF Health News. I mean, I'm laughing because we both went through it, and it's just horrible, and it comes on so quickly, but it leaves quickly, I think, for most people. Why don't you go ahead and tell us what norovirus is and what are the common symptoms?
Sure. So norovirus is a highly infectious virus, causes nausea, vomiting, diarrhea, abdominal pain. And what's important to know is for most people, it's pretty mild. You get over it pretty quickly. The key is
mild.
Well, as these things go, you're not landing in the hospital, right?
True.
You know, so unless you're somebody, if you're an infant, if you're elderly, that's where dehydration can get you into trouble.
Yeah.
Now, I did get norovirus myself last week. Yeah. It is not fun.
No.
You know, sick all night, vomiting. But, you know, by morning I was feeling better. If you are somebody who gets norovirus, though, you really should be careful about food preparation, washing your hands, because you could still remain infectious to others for a couple days after.
So let's talk about what is causing this spike in cases. You said highly infectious. I mean, is it just this is the time of year when everybody travels and sees people?
This is the time of year we typically see norovirus cases peak and sometime in the winter. With all the travel, the gatherings, you know, I'm pretty sure I probably got it for one of my little nieces.
Oh, blame the niece on TV. Brutal.
Well, to be fair, this happens every holiday season. We end up with something going through the family. But, you know, little kids don't wash their hands as well. And so even if you're trying to be as meticulous as possible, sometimes it's really hard to prevent it.
What are some tips for people? You mentioned the washing of the hands. I mean, maybe I got it on a plane, but who knows? Is it wear a mask if you can? What's some of your advice for people?
Yeah, so the most important thing is wash your hands, but use soap and water. The alcohol sanitizers don't really work for this. Be sanitizing any food preparation surfaces. And just realize, you know, you may touch something not even realizing it's a contaminated surface. So be sure to wash your hands, not just after using the bathroom, but before eating.
Okay, good. All right, let's talk about respiratory viruses, because the CDC is also reporting respiratory virus is high. That includes COVID, it includes RSV. What should we be doing? I mean, we know that obviously we were talking about it before. We had talked to a doctor prior, all these gatherings. We knew cases would be on the uptick, but what should people be doing?
Well, so flu, COVID, RSV, they're all increasing. They have not peaked yet. It is not too late to get vaccinated. I think that's really important to know. Everyone 6 months and older, age 6 months and older, is eligible for both flu and COVID vaccinations. People who are pregnant or 60 years of age and older are also eligible for an RSV vaccine. And this is really the best tool you have to prevent these infections. Masks do work. And so if you're somebody who's immunocompromised, older, have underlying medical conditions, just want to play it safe, especially on public transportation, you may want to wear a mask.
I do want to ask you, because some people, you know, they feel like they have peak symptoms one day, so they stay away from family. Maybe you're visiting, maybe they're masking, but then some of those preparations start to wane in the latter days. I don't know if you want to go by each one, but how long typically is someone contagious after contracting something like this?
Yeah, it can be days, sometimes even a week or two, depending on the infection. One way we know, at least with COVID, and probably this works pretty well for flu as well, is those at-home rapid tests. So now we have combo tests for both COVID and the flu. If you're still testing positive, you probably are still contagious. So that's one way to assess, like maybe you're going to go visit grandma in the nursing home. You should probably test if you've recently been sick to make sure you're not infectious still.
I haven't seen those combo tests. That's a good pro tip. Dr. Celine Gounder, thank you so much. Happy New Year.